What is the role of the rehabilitation doctor in a personal injury case? From a healthcare standpoint, personal injury cases can involve a wide array of professional disciplines ranging from medical, chiropractic, physical therapy, speech therapy, and psychology, just to name a few. These different healthcare specialties not only treat the patient to help them return to their prior level of function, but they can also offer a great amount of information as to the patient's future prognosis. Each discipline can offer great insight as to how the patient is progressing respective to their scope of practice. Many times, however, the treating medical doctor, amongst a team of other healthcare professionals, is often expected to give an opinion as to the overall prognosis of the patient. Medical doctors typically give an opinion as to whether the person has achieved quote-unquote maximal medical improvement, but often have to consult with rehabilitation doctors as to the person's rehabilitative potential in order to make this determination. This is because medical doctors diagnose and treat pathology, and rehabilitation doctors, such as physical therapists, evaluate and treat dysfunction. This is why a collaborative approach amongst various healthcare professionals in determining overall prognosis is imperative. Here's an example of how this determination comes into play. The reason why this collaboration is imperative with the rehabilitation doctor is because of their unique training. If you ask a physical therapist to prescribe certain medications or read an MRI or CT scan, they're not able to do this because it's out of the scope of their practice, and they're not trained to do so. That's for radiologists. Not to mention they're not licensed in that field. On the other hand, if you ask a medical doctor to perform physical therapy treatment, they would not be able to successfully do so because they're simply not trained in that. Each respective discipline, both medical and physical therapy, have their own unique set of skills and training which helps give them the credibility to opine on different aspects of the patient's overall prognosis respectively. Oftentimes in trial, the question regarding what is the patient's rehabilitative potential comes up, and whether they have reached that maximal rehabilitative potential or maximal medical improvement. If the appropriate experts are not in line to give an expert opinion on this topic, it will be very, very difficult to prove to a jury if maximal medical improvement or maximal rehabilitative potential has been achieved. As a doctor of physical therapy, I have testified in numerous trials against numerous medical doctors ranging from orthopedic surgeons, physiatrists, and interventional pain physicians. In the majority of time, the opposing opinion of these experts is different from mine in regards to the improvement of the patient. It's not necessarily that their opinion is wrong. It typically comes down to their opinion based off of the pathological condition that is going on with the patient or client, as if that diagnosable condition has been cured or if there is an impairment that still exists. From the rehabilitation doctor's perspective, we are looking for the overall rehabilitative potential of the patient and whether their function will improve or regress over time, thus providing a rehabilitative prognosis. From a medical standpoint, the person may have reached maximal medical improvement from a disease or pathology standpoint, but the doctor of physical therapy standpoint is if the person has reached maximal rehabilitative potential. The physical therapist has the education, experience, and expertise to opine on this question with certainty, and it should be integrated into determining the overall prognosis of the patient. So make sure you provide the insurance company and or jury members with both the medical doctors and rehabilitative doctors' opinions in order for an accurate, well-rounded prognosis to be made.